Hey friends, thank you for tuning in to the Occlusal Table, where we bridge dentistry with business, culture, and current events. I'm your host, Taylor Jackson, and for today, we'll be continuing our Match Day series and taking a deeper look into oral and maxillofacial residencies. Let's get started.
Hey everyone, I am so excited and honored to be a guest on this podcast today. My name is Hannah Jeffress-Vanders, and I'm a fourth year dental student at Meharry Medical College School of Dentistry. I am also an officer in the Army, and I will be attending residency in the fall at Walter Reed National Military Medical Center. My family lives currently in Johnson City, Tennessee, and I attended George Washington University for undergrad, where I studied biology and music. I play piano, I love to sing. And in my spare time, I also love to complete daily Wordles with my husband and practice hot yoga.
Good morning, everyone. My name is Crayton. I am a fourth year dental student at Meharry Medical College. I am from Chicago, Illinois, born and raised, and I have recently matched into Howard University Hospital in Washington, D.C. A little bit about me. I graduated from Fisk University, which is located right across the street from Meharry, where I was a biology major. And in my spare time, I like to play guitar.
Awesome. Well, we are so happy to have you here on the show, guys, and congratulations. Woo! I know that it is a huge accomplishment to match into a specialty program. So I guess if we can jump right into the questions. So what was your dental journey like, and what led you to pursuing oral surgery?
I'll go first. So I actually decided pretty late in my academic career that I wanted to pursue dentistry. I really didn't start until the end of my sophomore year of college, which seems kind of crazy. I started as a music major, and then I decided I didn't really want to pursue a career in that field. So I started just taking some other classes in a variety of fields. I've always been interested in health and medicine. So I was taking a public health class, and we ended up doing a case study about a little boy who actually passed away from a tooth abscess. And for me, I'm pretty spiritual, so that was a little bit of a God moment right there. And I decided right then and there I was going to be a dentist. And my family was very surprised and confused because I'd been doing a lot of music. But I'm very blessed. They were very supportive. Completely changed all my classes to start taking prerequisites and start studying for the DAT. And I haven't looked back since. And as far as oral surgery in particular, the very first week of classes at Meharry, actually, we had one of our faculty members who served as an oral surgeon in the Army. She was sharing stories of her cases throughout her career, and I remember being just fascinated by just the huge scope of the specialty, facial reconstructions after trauma, diagnosing and treating different kinds of pathology. And everyone, it's a little weird, but I do love the bloody side of surgery. But I wasn't sure if I really wanted to do more years of school after dental school. So I kind of just ignored the little voice in the back of my head. And then sophomore year of dental school, we started actually taking kind of the specialty courses, learning a little bit more about the specialties. And when we started taking the oral surgery class, I was like, I think this is it. Started going to the oral surgery clinic and observing more. And I was like, got to go for it. So yeah, it's been awesome.
Well, for myself, my story is a little different. I didn't realize I wanted to go to dental school until I was a junior in college. And so I had to, but I was always a biology major. I just wasn't exactly sure what I wanted to do with it. And so by the time it came towards being a senior, I realized that I still needed to take some prerequisites for dental school. So after graduation, I actually ended up having to take biochemistry at Tennessee State University. And during that time, I was studying for the DAT exam, and I was spending some time shadowing a pediatric dentist here in Nashville and an oral surgeon here in Nashville. And I enjoyed going to the pediatric office and, you know, watching him deal with kids, because I like to work with kids. But when I went to the oral surgeon's office and I saw him doing all these sedations and these, he had a portfolio of all these different orthodontic surgeries that he had did. I was like, wow, this is really cool. And so I started to, you know, spend more time looking into that. And by the time I got accepted into Meharry's post-baccalaureate program, and I took a gross anatomy course, it really just, it sold me right then and there. And so by the first day of school, I already knew, I was like, this is what I wanted to do. All right, so I took this, like I was saying, I took this gross anatomy course in the post-baccalaureate program, and I was really intrigued during the head and neck section and just the anatomic layout of the skull and being able to like fix these things and change the appearances of patients. And I spent more time like going back and shadowing in private practice. And so by the time the first day of dental school started, I knew what I wanted to do. And the chairman of the program gave a great presentation. I remember like she came in there and she was like, if you want to do oral surgery, you gotta be the best. Like, and I was just like, oh man. And I remember she showed all these photographs of all these cases that she saw. And I was like, this is really extreme. Like this is a dentist right here. Like this does not look like dentistry. But I remember like right after she gave this presentation, I was in her office asking her like, what do I need to do? How can I become an oral surgeon? What are the things that I need to be working on right now as a freshman? And I would do that. I was doing that every year. Like she told me to get my grades up, and she told me to take this exam. And so it really just started with that for me.
Yeah, it takes a very special person to go into oral surgery, because I had the opposite experience to where when we sat in that lecture, when she was showing all those pictures, I was like, this is what I do not want to do. Facial reconstruction, everything, like a laceration across the eye, forehead, or gunshot to the head, like, no. So, but you know, it does take a special person to do that. And it, you know, it's an honor to know both of you guys, you know, and pursuing your dreams and everything. Like I know exactly who to refer to. So when it came to preparing for the application, was location a big deal? The amount in the stipend? What was the criteria when selecting the schools that you applied to, and even the number of schools, if you would like to share that number as well?
So I think Marcus will have more to say about this. Since I am in the military, I did not really have much of a say in where I went. I was able to rank the military program. So how it works in the military, if any of you are listening and interested in pursuing military, for matching, it's basically you apply to the military program as a whole, and then you rank kind of which locations, which programs you like the best, and then you may or may not get those depending on other applications. But I did rank Walter Reed higher on my rank because I wanted a bigger program to be able to experience treating more trauma patients. I think I'm interested in that. But so as you're kind of thinking about what you want in a program, some things that you can think about is most oral surgeons are going to take call. That's one of the big things. But depending on the smaller programs, if they're level 1 trauma, things like that. So you can be asking residents and programs how often residents take call, what the patient pool is like. Do they do a lot of orthodontic surgery? Are they involved in oncology, reconstruction cases? And so that's because the scope of oral surgery is so wide. Most programs are not going to be able to do everything. So talking to residents, figuring out what you're most interested in, or you think you're most interested in, just to make sure that you are able to get experience in that would be my best advice.
Okay, so when I was applying, I at first I had to figure out if I wanted to apply to a 6-year program or a 4-year program. That was my first thought. I was like, okay, I know I want to do oral surgery. Do I want to do a 4-year or a 6-year? And I spent some time researching the different programs to see what do they do more at this program? What am I looking for in a program? So once I figured out I wanted to only apply to 4-year programs, my next main biggest thing was I wanted to be at a level 1 trauma center. I wanted to, that's where I want to train as a level 1 trauma center, because I want to be able to deal with these traumatic cases and being able to stabilize these crazy fractures and to help restore the aesthetic look or restore function to the patient. After knowing that I wanted to do a level 1 trauma center, I wanted to be in a metropolitan area. So I know they say to apply to the program and not the area. Well, I was applying to the area too. And I applied to a total of 33 schools. I applied to 33 schools. I wanted to give myself the best opportunity to land somewhere. I've been in Nashville, Tennessee for quite some time. I did my undergrad here, and I wanted to make my way back to a metropolitan area. And so I had some top cities on my list. I was fortunate to land in DC, which is one of my top cities on my list. But those were some of the things that I look for in a program. Also, what Hannah mentioned was some programs, they spend more time doing certain cases. I knew that I wasn't interested in oncology. Those are some things that didn't really interest me. I wanted to more so do general reconstructive surgery, orthodontic cases, stabilizing Lefort fractures, things like that. And so I wanted to make sure that I applied to a program where they get a nice little balance of the broad scope of oral surgery. So that's my spiel.
Yeah, and then even for the difference between 4 years and 6-year programs, majority of it, I don't know if it ranges or anything, but for the 4 years, that's when you get your oral surgery certificate. But then the 6 years, that's when you get your certificate and then your MD as well, correct? Just for our listeners to know if they don't know the difference.
You'll get the MD your second or third year in the program. You don't get it at the end. You'll get it the second or third year in the program. But as far as the training of as far as oral surgery is concerned, I remember when I was applying to Emory and with they had a video showing you actually receive more months of training in the 4-year program than you do in the 6-year program. But in the 6-year program, you will have you'll have a stronger basis of understanding in medicine, and so that's the difference. But as far as your hands-on of oral surgery training, you will receive the same amount of training.
Gotcha. Okay.
I think also, the other or one of the reasons why some people pursue the 6-year as well is if you're interested in a fellowship or if you're interested in more academia, some places, and I've talked to some people that say it's not an all or never situation. So if you do the 4-year, it doesn't mean that you can't do a fellowship or that you can't work in academia. But there are some programs that look more favorably on an applicant that has completed the 6-year.
So depending on your future career trajectory, basically, when it comes to choosing between a 4-year or a 6-year type of program. And then usually they only select 1 or 2, maybe 3 residents, right, for oral surgery? Or what's the biggest number you've seen? And I guess the smallest number is 1, right?
Yeah, I think usually I would say between 1 and 2, honestly. I don't know, Marcus, do you know some of the bigger places? How many have you seen?
Yeah, so the most that I've seen, this is the only program in the country like that, is the program in Houston. They take 6 applicants every year. but the hospital is huge. On average, it's mostly just two, mostly on average. There's a few programs that take three. Howard takes three. The program in Iowa that takes three, but most programs just takes two, and there are some that just take one. They receive a lot of applications. I remember Emory told me they received over 400 applications for 4 slots in total, 2 for their 4-year and 2 for their 6-year. A program in Florida told me they received about 300 applications for 3 slots. So it's really small.
Yeah, they really have to be selective. So you really have to make sure that your application stands out. So that's why I applaud you guys even more for that, because for me and my co-residents, there's going to be 9 of us, so, and I wanted to have that kind of program as well. But going on into the application some more, what was your CV like? So what did you get involved in during dental school to help build your CV?
So for me, the CV is really just, like you were saying, a place to kind of show off how you spent your time in dental school or before. If you have things that you're proud of, you don't want it to be crazy long, because I'm not going to look through everything, but you don't be afraid of bragging a little bit. This is you putting your best foot forward, telling the application why you'd be a great candidate for residency. So I was involved in some things at school. So like ASDA stuff, e-board of my class kind of positions, so like leadership positions. And then I also wanted to have things that were on there that weren't just dental related. So like volunteering wise, like I went to some food pantries a few times a semester, worked like with volunteering to read to middle schoolers, like things like that. I always tell people don't do things that you hate doing just to put them on your CV. First of all, because you're already in dental school, a lot's going on. Like, don't do something that you hate doing just for this application. And second of all, if they ask you in your interview about some of these things, you want to be able to talk about them and how they helped you grow as a person. So you don't want to have to talk about things that you hated doing. So yeah, I would just recommend doing things that you like to do already, and show that you are a well-rounded person, show some leadership. And yeah, that's really my best advice.
For my CV, I spent some time into it. I actually had a little photo of myself on there. I tried to make it look real nice. But like Hannah was saying, you don't want it to be too long. And I know that they go through a lot of different applicants. And so I had the most important things at the top that I wanted them to see, and the things that, if they get to this, then they get to this, but I need them to make sure they see this. And so as far as like grades and scholarships and honors, community service, things like that, I had towards the top of my CV, because all of these programs, they're looking for a well-rounded applicant. They're not looking for somebody that goes to dental school and comes back home and studies and then goes back to dental school. That's not what they're looking for. They're looking for a person. And so I just wanted to show on paper that, this is me, and this is a little bit about me. And, I'm also a good dental student. So that's just kind of how my CV was formatted.
So then on the flip side of extracurriculars, grades definitely matter, especially for oral surgery. Like, what is a good competitive range, excuse me, for those pursuing oral surgery? And then for those that may not have their GPA in that ideal range, what do you think they can do to help, get noticed in these programs? Or is it just like a non-negotiable kind of thing?
I definitely wouldn't say non-negotiable. Now, maybe if your GPA is under a 2, I don't know. And again, military is a little bit different as far as kind of the cutoff. I think usually what they say is if you're under a 3, it's going to be hard to be noticed. Again, not impossible, but much, much less likely. I think for civilian, ideally a 3.5. I don't know if that's correct. Marcus can correct me when he speaks, but so ideally I would say a 3.5 is where you'd want to be. Obviously even higher is better, but we all know dental school is challenging. So yeah, so I would say around a 3.5 is ideal. And then if you are under that, or you just want other ways to make yourself stand out, what my mentors have told me is externships and shadowing as much as possible, working with either faculty members or if you have oral surgeon contacts outside of school. That way you have really, really, really strong letters of recommendation. And if you're externing at programs that you are interested in applying, they're going to remember that. And performing well on those externships. So making sure that you know a little something before you go, you're ready to answer questions, you're ready to stay with the residents when they're taking call during however long you're there for. Those would be the best ways that I would say to stand out.
I can't really speak on like what was the minimum of what they're looking for on too much, because at every place that I extern, I asked the program director, like, what are you looking for in an applicant? They all told me they're looking for somebody in the top 10% of their class. They all said that they're looking for somebody with a passing score on the CBSE. They're looking for somebody that, they also say they're looking for somebody that's a team player. So that's something that you can kind of like convey through letters of recommendation in your CV. And they're also looking for somebody with experience. So if you don't have the strongest GPA, you want to have a very strong test score. You want to have some experience at a hospital-based program so that you know what it's like to be on call, what do you know what it's like to be in the OR, because people think oral surgery is just taking out teeth, and it's not. I mean, you will be in the OR all day for one case, and so these are some things that you'll find out, like if this is really what I want to do. Like you'll find all that out on an externship where you're getting paid at 3 o'clock in the morning for some laceration or something, and you got to go figure what this is, and you're tired and you're sleep deprived, and that these are things that that they're looking for. They want to look for somebody that has an experience. And so because when you do get interviewed, they're going to ask you about your experiences. They're going to ask you the typical interview questions, tell me something about yourself and things like that. But they're going to want to know, what have you seen so far in oral surgery? So I would say that if you don't have the best CBSE score, you want to have a very high class rank. If you don't have any of those, it's really hard. It's really hard, that doesn't mean that it's not possible, but you got to get that score. If you don't have the grades and you want to spend as much time around oral surgeons.
Now, you guys touched on two important things that I definitely want to dive deeper into. You guys talked about externing, and you guys talked about the CBSE exam. So let's talk about the exam first. What exactly is that? When did you guys take it? What is an ideal score? Is it pass, fail? What is that exam like?
Well, that exam, it is a beast. I'm not going to lie. It is a beast. So the CBSE is equivalent to step 1 for medical students. Basically, it's scored differently when it's the CBSE, but the material is about the same as step 1, which is like the first 2 years of medical school. So depending on how in depth your anatomy was in dental school, you will probably we didn't do the lower limb when we did gross anatomy. So, and I did have several questions on that. I had a lot of pelvis questions on my personal test. So it's a lot of teaching yourself, a lot of watching videos and reading first aid and all of that. So you can take it whenever you feel like you're ready. And with COVID, it kind of changed how often it was offered, but it used to just be offered in February and August, I believe, or Marcus, I forget when exactly. It's offered specific times, it used to be, but I know a lot of my classmates took it the February of D2 year. And then that way you have some time if you want to take it again. Especially if you don't do as well as you want to that first time, showing programs that you recognize that you could do better, you attempted it again and you did better, that really shows something about your character, about how you would be as a resident. You're never going to be perfect at everything you do. We're learning. So showing that you are willing to put in the effort to do even better. From what I've been told, it does look good on an application. I took it since I had decided so late that I wanted to pursue oral surgery. I took it the summer before third year. So I took it in August before my third year. And yeah, my biggest advice, I do have kind of a list that I send out of my resources and kind of a sample study guide, kind of what I did. So if anyone's interested, I'll give my email at the end. So I'm more than happy to send that out to anybody, answer questions, because I know it is a beast. So the more information you can get, but the biggest resources I use were UWorld. So doing questions, as many questions as you possibly can do. That was super helpful. UWorld is a little bit expensive, but 100% worth it, I would say. And then I also watched a lot of pathoma videos, and first aid is a good way to kind of just go back, review your biochem, your physio, all of that.
Yeah, so the CVSE, it's very tough. Like Hannah just said, it's very tough. I had to take it more than once. And I also want to recommend Sketchy Micro. The camera, Sketchy Micro for those, and Sketchy Farm. Trying to show it, but yeah. And pathoma is very important as well, because then the reason why it's so imperative that you do well on this exam is because I remember one program director, he said, the reason why we're looking for a certain score is because if you don't do well on this, if you don't, score this certain, score on this exam, you're not going to do well in this program, because in oral surgery, you have all these different rotations. For first year at Howard, you're going to be on internal medicine, you're going to be on anesthesia rotation, along with being on oral surgery rotation. So internal medicine is not something you're going to learn in dental school. You're going to get, you're going to self-teach yourself some of this stuff, and some of this is going to come back from the CVSE when we're dealing with all these labs and all these patients that have all these different diseases and diabetes and COPD. Like, these are things that you're not going to really deal with so much at dental school. And so it's really imperative that you self-teach yourself these things during dental school, because you're going to see it again. You're seeing all this again. You're going to be diagnosing pathological lesions in the mouth. Like so it's very important that you take this exam very seriously. This exam is if you don't score a certain score, you won't get into a program. It gets more and more competitive each year, and so that's just my take on it.
So it seems like they have to have like different criteria to kind of like weed people out in a sense.
Kind of, yes. And I guess, Marcus, you can tell them what programs told you as far as a minimum if they did. I think above 70 usually is what I've heard the most. So yeah.
Well, from program directors, like from the ones that I've asked, they said one's at 200, one's at 194. It depends on what program you're applying to. Some program directors are not as big on the CBSE score as other programs are. It just depends on where you're applying to. But I would try to have that score as high as possible. There are people that have gotten in like in the 60s. I mean, just a few years back, there's some people that got in like with high 50s, but it just gets more and more competitive. So that number changes every year. The number changes every year. So what somebody got in with last year might not be the same score that you need to get in this year. So.
Definitely good to know for those that are interested in pursuing oral surgery. So then you guys also talked about externships. So did you guys have to reach out to the program director, or do they already have these externships in place for you guys? How did you guys plan those trips?
So again, I'll kind of tell you the military way, and then Marcus can tell you all the civilian way. So for me specifically also is crazy timing because I was deciding right when COVID first started. And so some programs weren't doing externships at all. So the past couple of years have definitely made the whole process a little bit more challenging. I know virtual externships are becoming more normal. But I would, if at all possible, go on an in-person externship. Because like Marcus was saying, you will, for yourself, just knowing whether or not you actually truly want to pursue this, that is the main way that you will find that out, is by going on that externship, being with the residents, taking call. That's the only way you can know for sure if that's what you actually want to do. As far as how setting up the externships, some military programs, you had to apply for the externship. And those ones were kind of shut down with COVID, but there were 2 programs that I reached out to, and I just emailed the program director and their business assistant, just asking them if it was at all a possibility. And 2 of them emailed back and they were like, we'd love to have you. If you can drive here and get here, we'd love to have you. So I just picked a week, told them I was coming. At one of the locations, I stayed with a friend who lived in the area, and another just bit the bullet, stayed in a hotel. Wasn't really in the hotel much. So, but so yeah, so I did 2, and I think that was a good sense. I wish that I had done maybe one more, just so you can get an idea of kind of multiple different programs. And then really just make sure that you're as prepared as you can be. They know you're a dental student. They know you're not a resident yet. So you still have time to learn more. But at one in particular, they really treated me like a resident, and they pulled me into a conference room and said, hey, tell me everything you know about methemoglobinemia. Like, just tell me everything you know. And you're like, whoa, okay. Here's what I know. So, and they love that. And it's a great way to learn. I know it's stressful, but I like that kind of environment. So I think I'm going the right route, because I enjoy that, even though it is stressful. But so you can really impress your potential future attendings by knowing a little something in dental school. So show that you've read a little bit. And that way, when you are applying, they'll remember you, they'll remember your name. So yes, I would recommend at least 2, if at all possible. But as many as you can do really is better.
Yeah, so for those who are applying through a DIA Pass, as far as externships go, you would have to go to that program's website, and on their website, they will show you who you need to email, and it's never the program director. It's like one of their secretaries or something, and they'll email you back a form and some paperwork that you have to fill out. Well, actually both of the places that I went to outside of Meharry required that you have some other type of private insurance to cover yourself while you're there. The 2 virtual externships that I did are nothing like an in-person externship. So if you did like 6 virtual externships, like they're gonna look at that like, why didn't you go anywhere? Like it's not going to be the same. And also it's important that you try to do as many externships as possible, because just because you go somewhere, that doesn't mean they're going to be, it could be a slow week. It could only be like 2 OR cases. You could be seeing the same type of things. I remember the first externship that I went on, we were in the OR about 3 times, but it was like, they're all the same type of procedures. They're just plate mandibles. And so I didn't get to see as much on that externship as I did when I went to a different one. When I went to this other externship that I went to at Cook County in Chicago, it was just, I just so happened to be there on a crazy week. And at the end of the week, like I remember the 3rd-year resident, he was like, God, like, why are we getting all these cases this week? And they're all like long, like, because, I mean, we're in the OR for, I remember one time we were in the OR for 6 hours. The next day we're in the OR for 8.5 hours. And then we had a few 3-hour, 4-hour cases like that week. And so I got to see a lot, and I got to see a lot of different approaches to how they went about fixing these different type of fractures, and what things that had to be done before the oral surgery team went in, because sometimes these are team cases where the critical care and trauma burns team goes in first before the oral surgeons go in there. And so it's really important that you try to go to as many different programs as possible, because every program doesn't run the same way, and you get different outlooks on things. And so I felt that like that Chicago experience that I had was it was tough, you know, going there, but also while I was there, they were also doing some cancer cases, and that's why I realized that I don't want to do oncology. I mean, people are scrubbing in at 7:30, and it's still 7:30 p.m. and they're still in the OR. I'm just like, whoa. So yeah.
Yeah, that's the beauty of externships, right? You know, you can see what you want to do and things that you don't want to do. You know, that's why you definitely want to go and travel to these different schools and different programs, because the fact that you did go on there on that crazy week, you were able to see more than probably someone that was just there the week before, you know, and didn't get that same experience. So it's definitely good to go to multiple programs to get a good gauge of what you would be doing as a potential oral surgery resident. So just a couple more questions here before we wrap things up. So then with all these experience that you guys have had, your grades, your exams that you take, now we're at the personal statement where you tell your story and you show the human side of you guys, you know, and show that like who you are on paper, so that can jump out to whoever's reading your application. So how did you guys prepare your personal statement? Did you guys have a lot of people read it? How did you go about making that personal statement to tell your story?
Yeah, the personal statement was definitely the hardest part of the application for me. Just because, and sometimes I just feel like I'm not the most interesting candidate, but I would say the biggest thing is just trust that your story is unique and special. So don't be afraid to confidently just say what your story is. Like, you know you best, so you're gonna know what to put in there. But yeah, exactly like you were saying, I would say the most important thing is to have as many people as possible read it. So I had, I think, 6 faculty members read it. I had some of my friends read it. My parents read it. So it doesn't have to just be dental personnel. So just as many people as you can to read it, and give you kind of their feedback. A good way also to kind of be editing it is reading it out loud to yourself, to kind of see how it's flowing if things aren't making sense. Sometimes it's hard if you're just reading it on paper. And then also emphasizing anything on your CV that you're really, really proud of, or you really want to make sure that gets emphasized. I know sometimes you're like, well, it's in my application, so of course they know that, but it might have been a really long day, the application, they're just reading personal statements that day. You never really know. So anything that you really want to emphasize, put in there, and then have as many people as possible read it.
Yeah, I would agree with Hannah as well, with saying for me personally, the personal statement was the hardest part. It's kind of stressful because I was like, I don't know what to put about myself, and it's very important on your application. I remember being on one interview, and the program director himself said, "Some of you all are here today based off of your personal statement." I was just like, wow, like. And so he's like, I read everyone's personal statement, and I had some faculty members, I had some friends. I have my uncle who's a lawyer, like helped me put the final touches on my personal statement. I had it. My personal statement was just one page. It was like first paragraph was about me. Second paragraph was like why oral surgery. Third paragraph was like why me, or something like that. And so because at first I had a 2-page personal statement. Then one of the staff members at Meharry helped me bring it down to 1 page, and then I just kind of went about like just constantly festooning it, and I was happy with the overall final draft. But it takes some time. I don't wait till the last minute to do your personal statement. Please do this like a few months in advance. Like this is not something you want to just wait like a few weeks or a month before the application cycle starts.
I wholeheartedly agree with that statement, Marcus, because I know it took me some time to dig deep, like, okay, who are you? I'm a different person than I was as a pre-dental student. I can't just revamp, what I used to get into dental school, and I say that all the time to anybody who asks, like, you are a different person. Please start early, because this thing here is so important, because all you have is that paper application. So then moving forward into the last question, is there anything that you wish you knew prior to the application cycle? Or if you can tell yourself something as a first year, or telling first years now that are interested in oral surgery, what you would have done differently, or something that you're glad you did so that you could be successful in this moment?
Yeah, I don't think there's anything that I wish I had known before applying. I knew going in it was going to be a long, hard process. So I think talking to people, I basically knew kind of what to expect. I would encourage everybody to, as soon as you want to pursue this, start getting organized, stay on top of letters of recommendation. I will say I didn't know that I wanted to pursue oral surgery right away when I started dental school, but I still knew that it was important to make relationships with faculty members and really cultivate those relationships through the first couple of years. And so I'm very grateful that I did that. So even though I decided super late, those faculty members that I ended up asking for letters of recommendation, they knew who I was as a student. They knew how I was as an applicant. So really making the time to get to know professors, have them get to know you, and then just be organized. And in this field, oral surgery, that is going to be a crucial part of your matriculation through residency. Like, you're going to need to be organized. You're going to need to be good at time management. So practice now, and that will definitely serve you well moving forward.
One thing that I want to speak on is the importance of after you've completed your CV, you've got your test score, you've got your personal statement. Please sit down with some of the staff members, if you can sit down with an oral surgeon from your school, or someone who can give you a mock interview. It is very important that you have some interviewing skills before you go into an interview, because they're going to ask you all types of questions. Some are going to ask you questions that they know you don't know the answer to, but they want to know, how are you going to respond to this? And so you want to have some mock interviews. You want to have some people drill you before you you sit up in these rooms because you're only going to have 15 to 30 minutes with, with all these people. They're going to ask you these different questions, and then they're going to say, thank you for your time today. So you want to make sure you get your mock interviews in. Okay.
Oh, that's right. Even for interviews and everything, did you guys like have them in person, or were all of them virtual, or did you have a hybrid? Like for your interviews, what were they like?
Mine were also virtual, but also in person. When I was in person, I was in a like a conference room at the front of the table, and everybody was firing off different questions, and that's really where your that's where you really can shine on your externships, because they're going to ask you about what you've seen, and I remember they asked me about like, what's the longest I've been in the OR? Like, can you speak on your experiences? Like, have you taken call? What are some of the things that you've seen while you've been on call? Like, and then they'll ask you questions based off of your experiences. Like I remember they were asking me about like why they tested for this certain nerve while they were doing a certain approach. These are all like really important. So these externs are really important because this is where you're going to really talk about these experiences. You're not really going to talk about them in your personal statement. You're not really going to you're just going to list where you went on your CV. And so in your externship, on your interviews, they're going to ask you about these experiences. When I also, the virtual extern interview is a little bit different. I was still a little nervous, but it's different when you're in person, because you can sell yourself as a person. You also get to see the facilities. They'll take you on a tour of the facilities, so you can really see if this is if I like it here or not. So those are some of the pros and cons. Like, you don't really get to see how the other residents are on a computer screen as you do in person. So.
Yes, mine was virtual as well, which, like you just said, pros and cons to that. I would say for that interview, like, still pretend you're getting ready to go on an in-person interview. So I know when I'm wearing my nice little business suit, you feel different when you put on that suit. So I would say just like prepare as if you were going on an in-person, and then make sure you set up your room nice, and make sure you're prepared. You find a room where you want to do it. Nothing crazy on the walls. No fans in the background. Turn off your air conditioning so that there's not like crazy noise in the background. All of the Zoom etiquette that we all are so good at now. But really just treat it like it is an in-person. And unfortunately, if that's all that they're offering, it will take what you can get, right? But and yeah, like you said, he'll ask questions that you may not know the answer to. Like we're talking about why I want to do oral surgery, talking about my strengths and weaknesses, how I'm planning to tackle the rigors of a program. And then he's like, all right, like my last question, tell me about the Krebs cycle. And you're just like, okay. Like they're really just like, they playing games, and yeah, so you just never know. And so like, obviously there was no way that was I really studying the Krebs cycle the night before my interview? Like, of course I wasn't. But they just want to see how you handle that. Like, did I freak out and start hyperventilating? Like, no, just calmly say what you know, and then say, I have some studying to do, or something silly. That's just what my brain told me to say. But so yeah, so just, and be yourself. Like, they want to know who you are as a person. So.
And it shows like your humility too, because we don't know everything. You weren't studying the Krebs cycle, like you said, the night before your interview, because we haven't really looked at that since biochem. So it's like, you got to make sure you stay on your toes, but it's okay to not be perfect. And just to show, hey, if I don't know the answer, I'm going to say I don't know the answer. But when you ask me again, I'll make sure I find out. you know, and going from there and moving forward. Okay, but before we close out, if this episode has helped in any way, please give a thumbs up and hit the subscribe button so that we can reach more viewers like you. So Hannah, Marcus, do you guys have any closing remarks, or you want to share your contact information that people know how to find you?
Yeah, definitely. So on Instagram, and my name is kind of hard to spell, so but it's just at Hannah Jeffress-Vanders, all one word. And then my email is hannah.jeffress, and it's JEFFRESS@gmail.com. If anybody wants to, I can send over my CV as a reference, my list of CBSC resources, anything like that. And then I did just want to say one quick thing. I know that especially as a woman going into a mainly male dominated field, it can be a little bit intimidating. I do have some amazing female oral surgeon role models that I've been able to connect with and get advice. And I also recently read this book called Behind Her Scalpel by Kathy Hung, Leslie Halpern, and Rania Habib. It has some amazing testimonies of the pioneers in the field, really showing that women can be successful in this field too. I personally have been told on multiple occasions that I am too nice and too gentle to be an oral surgeon. And I've really started taking that as a compliment, because I know that is one of my strengths. I really care about my patients, and I don't ever want to lose sight of that. I don't want to change who I am because I'm going into this field. So I really just encourage everyone, and not just women, but everyone going into this field, to kind of be reflecting on what your strengths are as a provider, as you're finishing up dental school. Like, what do you really take pride in your craft, and lean into that as you go forward in any specialty that you're pursuing, because who you are matters and is important.
Yeah, so if anyone wants to, well, before I start, I just want to say that book that you just talked about sounds really interesting. And I might check that out myself. But for those who have any questions about the interview for the Idea Pass cycle, you can email me at marcus.crayton82@gmail.com. And I can also be reached on Instagram at Craydo, spelled CRAYDO_. But if you just search my name, you should find me on Instagram as well. And I'll be glad to, answer any questions, or send you what my CV looked like, and answer any questions that you might have about the CBSE or the application cycle and things like that.
Awesome. Well, I appreciate you guys for both being here today with me and sharing these gems for those that are interested in pursuing oral surgery. But that's all that we have for today. So thank you for sitting with us at the table, and remember to stay flossing and keep flossing. Bye, guys.